Hello, everyone, and welcome to IDA's webinar on One Health. My name is Efremia Konstantinou, and I'm honored to be your host today. Our webinar today is called Writing One Health Horizons, Foodborne and Waterborne Diseases in a Changing World. Here is the agenda for today. We have an outstanding lineup of speakers who will share their expertise and their insights. First, Rodrigo Scottini will give an introduction to IDA, and then the speakers will follow with their presentation on their insights. We will also have the Q&A session at the end, where you can ask your questions to the speakers. You can write it on the chat, or you can raise your hand, and then I will give you the opportunity to talk. Thank you for joining this important conversation, and let's get started. I will now give the floor to Rodrigo Scottini, who is the Executive Director of the Infectious Disease Alliance. So, Rodrigo.
Thanks, Efremia. My name is Rodrigo Scottini. As Efremia said, I'm leading the Infectious Disease Alliance, and thanks everyone for attending this webinar today. This webinar will also is being recorded and will be uploaded into our websites, and it can be seen also a posteriori. It can also be shared in our network, in your network as well. So the Infectious Disease Alliance is committed to addressing some of the world's most pressing infectious disease challenges through a One Health approach. By integrated human, animal, and environmental health perspectives, we strive to develop sustainable solutions that strengthen disease surveillance, improve response mechanisms, and inform policies that prioritize global health security. Foodborne and waterborne diseases remain significant global public health threats, exacerbated by climate change, global trade, urbanization, and antimicrobial resistance. Those challenges highlight the urgent needs for enhanced detection, prevention, and response strategies to safeguard communities and ensure resilient health systems. Despite advancements in food and water safety, outbreaks continue to occur, underscoring the need for coordinated efforts across disciplines and sectors. Today's discussion is more important than ever. By sharing knowledge, fostering collaboration, and advancing One Health solutions, we can strengthen food and water safety, mitigate public health risks, and build more resilient systems to protect human and animal populations alike. So welcome to this webinar. One Health is a very important part of the IDA Alliance. We're closely working with a lot of actors in One Health space and AMI space. I will briefly introduce our organization in a couple of slides. And since you are not a lot of people today, I'll be happy to make it a more interactive event. And we're going to have a quick round of introductions of people around the table. So feel free in this initial session to have your cameras on, to get to know each other. And we're going to have a Q&A session in the end where everyone can ask questions and maybe present a bit of our work and interest in the area. So if it's okay, I would like to request the sharing of the screen. Let me see if it happens. So IDA, it's a membership-based organizations. So if there are any of you working in NGOs, civil society organizations, we'll be very happy to follow up a conversation with you to see your interest in joining the Alliance. It's free of cost. You can get access to resources. You can get access to a number of members and activities. I will just very quickly present here what we're doing. So let me know if you can see the slides. Yeah, I think it's appearing. So we are a public health advocacy organization that works for reducing the burden of infectious diseases and improve access to healthcare. Uniting civil society is a very important part of our work. What we do, so we advocate for impactful policies and sustainable finance, and work on unifying civil society, promoting healthcare systems strengthening, fostering cross-sector collaboration and One Health. We promote equity and amplify underserved voices. What we offer access to tools to our members, opportunities for global alignment and advocacy and support. The Infectious Disease Alliance provide a joint representation of civil society, unify the fragmented infectious disease community, and bring accountability to policymakers, as well as promoting exchange between actors. Working partnerships is really important for us. The members are civil society organizations, as I mentioned in the beginning. Members' benefits are as follows if your organization is interested in joining. Then we have the committee areas here in this slide, which is ranging from vaccines, preventable diseases, to One Health, and more, cross-cutting areas like digital health, climate change, and so on. Some of our face events this year, if you're attending WHA or if you are close to Brussels or willing to attend our event in Brussels, here's our list of events. Here we have also the list of webinars planned for this first semester. You're attending the last one in March. There are other ones taking place in the end of the rest of the month. Yes, you can also see the list of events on the website. Sorry, it was not sharing. Yeah. So, but feel free to go to our website to have a look at this. This is our team, 40 colleagues based around the globe. Our mission and our strategy is also on our website. One Health is a very important part of it. As you can see here, applying to One Health perspective. I'd like to invite the participants, unless there is a speaker that have to leave soon, please the team inform us if it's the case. And the introduction of each other will not be cut off from the part will be set online. So I'd like to open for a round of introductions. You have met me. I'm the executive director. I'm from Brazil and happy to be here with you today. Over to Carl.
Hi everyone, nice to meet you. My name is Carl Aryan. I'm in charge of the committee management team at Infectious Disease Alliance. I'm happy to be here and over to our speaker, Carmen from ECDC.
Hello, everyone. My name is Carmen Varela Santos. I'm principal expert for One Health at ECDC, and my background is actually in veterinary medicine and field epidemiology, having worked also for a long time in the area of capacity building and training, and interested in this intersectoral training and approach. Thanks.
Maybe over to Constantino Dimitrios. You're on mute. Oh, we can see you. Nice to meet you. Maybe over to Ella.
Hello, my name is Ella, and I am the committee manager for the gender equality in health and the vaccine preventable disease committee with the Infectious Disease Alliance.
Maybe So Young Park, 안녕하세요.
Hi, my name is Soyoung Park. I'm currently working at Seoul National University Hospital as a registered nurse, and I've been admitted to London School of Hygiene and Tropical Medicine, so I'll be studying in public health from the start of September.
That's really great. Happy to hear that. We have a lot of people working in this area. I can connect with you about that. Maybe over to Victor Daniel.
Hi, good day, everyone. My name is Victor Daniel. I am a member of the Global Health Advisory Board at CAPI and also a project manager with ACASAS, where I lead our work on HPV. Glad to be here.
That's really interesting. Daniel, let's connect after the meeting. Please add us on LinkedIn. We can talk. Thanks for being here today. Charles Michael, maybe?
Hear me? Can you hear me?
Yes, we can.
Yeah, so Dr. Charles Akatobi Michael. I work as Senior Technical Officer with the Africa Center for Disease Control and Prevention, and I lead climate change and health in the agency. Thank you.
Very, very interesting to position you have. We'll be happy also to stay connected. Thanks for your introduction. Maybe Gabi? Yes, let's put the next one. Taina Niskanen, probably from Finland.
Hello. Yes, originally I'm from Finland. I work in ECDC. I'm a colleague to Carmen, and she sent this invitation came quite late. So I think we would have also other colleagues to participate if that would have come a little bit earlier. But a very interesting topic as working as an expert in food and waterborne diseases in ECDC.
Thank you, Taina. And we also had a webinar or an event in Copenhagen at the Danish CDC State and Serum Institute with Dominique Monet in his last months in the CDC. Maybe over to Mukuhi Mutumbi. Oh, he's having introduction in the chat. You can read it there from the Aga Khan University in Nairobi. Thank you, Mukuhi Mutumbi. Maybe Kosar from Iran. Yes, maybe she's not able to connect. Barbara Kinos from CDC. We have already had her introduced, right? Sorry.
Hello. Hi. Yes. So I'm Carmen's colleague. So I'm here to listen in and enjoy her presentation and also hear from the other colleagues. So thank you so much for organizing this.
No problem. Greetings to Stockholm. Wiebke? Yes, maybe not there. I see Iris is online as well. Over to you, Iris.
Yes. I'm Iris. I'm a global health. It's a global health, and I'm also committee manager at the IDA. So yeah, thank you.
Maybe over to you, Omar Sultan, for your brief introduction. You're on mute. You're on mute, Omar.
Is it okay now?
Now, yes.
Okay, thank you. Famia, can you share this presentation on your side there?
Yes. If you can just introduce yourself real quick, and we will proceed to the presentation.
Okay, thank you. Hello, everyone. I hope you are all doing well. Thank you for joining this call. I am Omar Sultan. I am a public health specialist. I am a professor of public health at the University of Zanzibar and the Kampala International University in Dar es Salaam. And as well as I do teach sometimes at the South Pacific University in Kiribati at the College of Health. And I am based currently at the Zanzibar Health Research Institute, which is a newly branch of the Tanzania National Medical Research Institute, but it is independent given the structure of the United Republic of Tanzania, as Zanzibar has its own government. So with its Ministry of Health, which is independent as well. So I am a WHO technical advisor. I am a member of the Strategic Advisory Group of experts, the highest advisory group for immunization, and the African Regional Immunization Technical Advisory, as well as the Neglected Tropical Disease Regional Advisory Group, and the One Health Technical Advisory Group. So I am very happy to talk about One Health because it's an area of expertise where I spent a lot of time of my career. Thank you very much for being here, and we appreciate your interest in the currently challenges and opportunities with One Health. Thank you.
Thank you, Dr. Omar Sultan. I think everyone has been introduced so far. Get back to you, Efremia.
Yes. Okay. So now we will start the presentations, the speakers.
Yeah.
Okay. Okay. And first, Dr. Omar Sultan, who's a professor, as he says, on Zanzibar Health Research Institute and a WHO technical advisor, who will talk about foodborne and waterborne diseases in a changing world. So over to you, Omar.
Thank you. Just go to the next slide, please. Yeah.
Here.
Yeah, this is no longer needed because I've already introduced. Okay. So this is no, just the first four pictures, please. The previous one. Yes. No, I don't see the picture. The picture on water.
The river.
Yes, this one. Yeah, this is as an introduction. Just you can have a look at this picture of very slightly milky water. This is a picture that I took during the cholera outbreak in 2016, 2017 in Sudan, in the just on the outskirts of the White Nile River in Sudan. It was just a east bank, and on the east bank of the White Nile River, and it was the water that was being supplied to populations to a chlorination tank that was just nearby. That I didn't. But I just want to show you the hardship that populations in Africa are facing to secure clean water, especially in countries whereby the countries in war, like Sudan, like Chad, but also the countries whereby the water and sewer facilities are no longer working, either because of bad governance or lack of funding, and sometimes it is because of distraction, because of war, and this is the end result. So next, please. This is on a market. It's a chicken selling place in the markets. One of the markets in Zanzibar, where you can see but the situation would look like the same in many countries in Africa, where you can pop it. Even when I want to N'Djamena and to purchase chicken, you see the conditions in which those who are involved in preparing the chicken are. You see the blood spill over all over the place. There is although there is a water tap, but even the person who's processing the chicken does not have personal protecting equipment, and you see the chicken lying directly on the floor, which could allow contamination. And currently we know we are aware of the avian influenza outbreak in Nigeria, and knowingly that Nigeria has a lot of contacts with people are moving from Nigeria to Tanzania and vice versa. I don't think that this is a very nice sign to prevent zoonotic disease. Next, please. Yeah, this is one of our teams from the Zanzibar Health Research Institute. We are doing some field laboratory water collection for analysis at the central lab. Next, please. Well, as a matter of introduction, I don't think that. Can you please put it a little bit big, please? Oh wait. I don't think that I can see that. I think my eyes are getting old. Let me see if I can just open it from here. Just keep the start on, please, and then, yeah. Okay. Yes. As a matter of introduction, we very much know that food safety is a public priority, and with its critical role towards the developing sustainable developing goals. And we know that that has a connection with goal number 1, 2, 3, and 6, and even to some extent 8 as well. But we know that from the WHO Health the Assembly resolution of 73.5 of 2020, it was declared like that there can't be development without water. But we know also as well as food safety depends very much from water safety, because it is what is being utilized in the preparation of food everywhere globally. So, but we are living in a very changing environment, and with new determinants. We have seen, for instance, nature ecosystem habitat destruction with invasion or mismanagement. We have seen so much invasion of forests and water sources as well. Where we have seen very poor protection of environment by sometimes by mining activities and farming activities, refugees accommodating activities. We have seen a lot of human and animal population growth as well. We have regular conflict like in my country and so many countries in East Africa, even in West Africa. We are seeing a lot of conflict. Even in Southern Africa, we are seeing a lot of conflict between herders and agriculturals. We have seen a lot of the migrants caravans with destruction of water sources that are on the way. We have seen so much climate change and climate crisis, water crisis, as well as we have seen so much pollution in the water. Like currently, we are seeing in many countries with the ocean around, whether it is on the Atlantic Ocean or close to the Indian Ocean. For a country like Mauritius, we are seeing a lot of used water, wastewater from industries that is released as well to the sea. We are seeing it in many countries in Eastern Africa, in Western Africa, Southern Africa. We can't say we are safe. Mining activities are also released to the sea. We have seen a lot of utilization of chemicals in the mining sector and the farming sector, like pesticides that are being released on the close to the water sources, the lakes and the rivers and even the sea. And the ongoing urbanization, many of the African countries are rushing to modernization. Many towns many previous villages are becoming towns, and with the bulk of release of chemicals to the water sources, we have seen a lot of increase in global food supply chain costs, because because of the war, in Ukraine, and the complications on the Red Sea, and so that many of the cargo are now no longer utilizing the Gulf of Aden, but now coming back to West Africa, all the way along from West Africa to Southern Africa to Cape Town, and that brings the cost of commodity food very high, and sometimes with complications in terms of freighting. We have seen water sources contamination with fecal contamination and dangerous mining minerals contamination, like lead, like cadmium, like arsenic. And we have seen the increased water cost because of desertification ongoing now currently in Southern Africa and some many countries in East Africa as well, and Central Africa and even West Africa. We have seen so many harmful behavior and norms and cultures that in the processing of water and even utilization of water that brings too many complications. Please, next slide, please. Next. Yeah. Now we have the One Health global progress, that there's some, although there's the bad news, but we have some milestone all over the world. We have seen a lot of initiatives and frameworks in various parts of the world, in Europe, in Africa, in Asia, and even in Latin America. We have seen strong linkages with global health, and unfortunately, although we are facing now a financial crisis in sustaining these interventions, but many majority of countries have developed health security plans, and that contain interventions in terms of prevention of zoonotic disease. We have seen multiple regional blocks initiatives, and as far as the WHO blocks and are concerned, and UNICEF, we have seen so many strong countries' government leadership and engagement with enacting of laws and review of standards and plans and policies and regulators' activities, and memorandum of understanding between institutions like water and sewerage, and as well as milk, dairy milk production, etc. We have seen multiple countries' initiative projects and collaboration that are going on. Currently, we have a project on antimicrobial resistance in Zanzibar, in collaboration with the Tanzania Sokoine University of Agriculture on the mainland, and the Zanzibar Livestock Institute Research Institute. We have seen a lot of environmental surveillance that have been going on. There is a collaboration between the University of Kinshasa and the University of Dar es Salaam. We have seen a lot of outbreak preparedness and response going on, like we have the declared that under control outbreak of Marburg in Tanzania, and that happened as well in Rwanda last year, and that happened as well in Tanzania in 2023, and in Uganda. We have seen, for instance, focus on several disease specific areas, the neglected tropical disease, vaccine preventable disease, acute watery diarrhea, vector-borne between the disease, and airborne disease like avian influenza. We have a preparedness plan actually on swine flu, on avian influenza, and we have seen, for instance, we have done a vaccination, cattle vaccination here against Rift Valley fever in 2010, and we have done as well a canine vaccination against rabies in Tanzania, on Zanzibar as one of the areas that were earmarked for that. And we have seen the strong linkages between WHO regional and country offices, coordination and support. And we have seen multiple partners involvement, as the European Union, the ECHO and DANIDA, DFID, USAID, Gates Foundation, Clinton Foundation, JICA, and Aga Khan Development Networks, etc. Next, please. We have many common diseases that impact to that are transmitted from animals to human and vice versa. And there might be variation from one region to another one. But currently, there is, for instance, an avian influenza outbreak in Nigeria, and we have Lassa fever outbreak all over the West Africa, but with Nigeria as the epicenter. We had brucellosis cases. Frequently, we had brucellosis cases in Tanzania with a lot of problem with dairy milk production because the many are just artisanal production, and with a big country like Tanzania, it is challenging to have dairy control and inspection everywhere. We have seen recurrent cholera outbreaks. Actually, the bulk of cholera last year and all over Africa, from Delna in Libya to South Africa, was we are seeing some multiple outbreaks here and there that need attention. But we have a threat of Rift Valley fever now with an epicenter in Kenya that is menacing Tanzania, Uganda, and Southern Sudan, and all the other countries in East Africa. We had a lot of cases of campylobacteriosis, especially even from babies that were put on some of the formula milks. We have seen cases of cystic leishmaniasis, echinococcosis, and salmonellosis. We have a threat of salmonellosis in USA, which and some outbreaks have been reported already. We have seen chromobacteriosis. We have seen bovine tuberculosis, because many of our farmers, there is not a currently available vaccine. We have some candidate vaccine for tuberculosis, but they're still to pass all the steps for WHO pre-qualification. We had cases of borreliosis in the southern Tanzania and leptospirosis, where, like I said, there is a menace of avian influenza, and then from West Africa. But we have seen cryptosporidiosis, which many cases are only discovered during the evaluation of patients with HIV, with the late stages of HIV/AIDS, and we have chikungunya cases. Actually, one of the research that we did when I was still in the Ifakara Health Institute, we discovered that cryptosporidiosis was like 40 to 45% of the population, which with animal husbandry, living close to with animal husbandry, like keeping chicken and even cats and dogs and even cattle. And we have seen a lot of cases all over Eastern Africa and the Southern Africa and Central Africa and all over Africa, in fact, even including in the Emro region with chikungunya, dengue, that are menacing public health, the Zika virus, and the Mpox with an outbreak currently in the Congo as an epicenter, but that spread all over the world, that still need attention. And we don't have enough vaccines yet. Congo received only 200,000 vaccines, which they cannot allow the protection of all Congolese. And looking at the regular exchange of travelers between Congo and the other East African countries and other parts of the world, I think it is something that we have to take very seriously. Crimea Congo hemorrhagic virus is all over Africa, and the transmission is all over Asia as well. And we have seen West Nile virus, Middle East respiratory syndrome, that is still menacing between the pig lineage and from and the other countries of the Middle East. And we have seen a lot of schistosomiasis, and currently with an increased number of female genital schistosomiasis that is impacting on the reproductive the women of reproductive age, and histoplasmosis with so many patients who are eventually HIV infected, but even, and then we see coccidioidomycosis and mycosporidiosis with cryptosporidiosis, as I mentioned initially, but we have seen Rhizospora belli as well, and trichinosis, and definitely the SARS coronavirus that although we had a very high vaccination rate all over the world, but I think there's still so many unvaccinated people, and the risk of transmission is still there, and the fact that we are not having a strong protection of contamination from forest to from the wild animals, and like the bats, and we cannot say that we are safe. And melioidosis in Asia, like in Bangladesh, and there were several cases of foot and mouth disease in Rwanda and in Tanzania and Kenya. So I think these are disease, and the risk can continue for consideration to whoever want to invest in the support of One Health. Please go to the next slide, please. So now a reminder of past and ongoing One Health crisis. Like I said, currently there is an outbreak of avian influenza in Nigeria, and which is menacing the other countries in West Africa and all over Africa as well, given the exchanges of travelers and visitors, etc. We have a Rift Valley outbreak in East Africa, in Kenya mainly, but with the risk of transmission to Uganda, Tanzania, Southern Sudan, etc. And we had a big problem of importation of cucumbers the last time in 2011 between Europe, and I think it made a lot of noise all over the world, and because there was a banning of importation from Belgium of cucumbers, and we had the old tanker explosion and spillover in Mauritius, which impacted a lot on population health, and we have high levels of pollution in Mauritius. Unfortunately, the level of sea contamination was not yet put clear, and we had the Rift Valley outbreak again in Kenya, and the foot and mouth disease, like I mentioned, in Rwanda, and then Uganda and Tanzania, and we are still having we didn't make any vaccination for foot and mouth disease, although Rwanda started the vaccination recently, and we had a lot of cholera outbreak all over Africa last year that made a lot of impact on and call upon several meetings of the African Union, and unfortunately as well as in the EMRO as well. And we had lake water contamination in Zimbabwe that kills a lot of cattle and population. And the ongoing water crisis and contamination in Africa or in general is pointing out that One Health is an area that where we should invest properly and strategize the better planning and collaborations in order to address them. The Salmonella outbreaks in the USA and all over Africa as well. Please, next slide, please. Now, the global challenges are we have to address the water and food crisis. In my country, if I reflect to my country, like the picture that I've shown you on the market, where showing a chicken processing room there in the market, you could see many problems on that picture that need to be addressed. But when you so they need consultations between those who are in charge of markets and then the public health institutions, but as well looking at the budgets that our ministries are operating with, and the challenge now of not having external funding, it will make things very difficult and put the populations at high risk globally, and that means whatever is happening in Zanzibar or in Tanzania might have repercussions on the other side of the world. And we see many agro-businesses, crops safety that need to be addressed. You have seen we have a lot of inter-country exchanges of crops that are imported from Southern Africa and to here, and from Central Africa to the West Africa. We have seen a lot of conflict between farmers and herders. Yeah, because the number of livestock have grown exponentially, and the number of population has grown as well. So the spaces, natural spaces, natural ecosystems have been involved and been invaded, and we need to address all the public health problems that are coming from that. And we have seen so many animal and human pollution of water sources. Like I said, majority of African countries are releasing wastewater through the latrines, down to the soil, and very few countries have a connected big pipe collecting wastewater and processing and recycling, etc. So, as a bulk of consequences, fecal contamination is a serious problem in Africa, and in so many parts of the world. I've seen, for instance, in other countries in Asia and Latin America. So the conflicts, armed conflict and political conflict, are impacting a lot to the problem with destruction of water processing machines and industries. Like I've seen the water processing plant in Sudan, that it was completely destroyed and it can't work, and it needs investment. So we see high cost of food. Sorry. Next slide, please.
No, Professor Amar, it says you have up to 3 to 5 minutes more. Okay.
Okay, perfect. So as the technical challenges we have is, again, we have to say it, we need more partnerships. We have very few for One Health, and we need better coordination between ministries and those who are in charge of One Health, and we need more funding. We have a lot of human resource capacity problems, because we don't have as many veterinarians in Africa as many doctors. We have many human doctors than more veterinarians. We have a few veterinarians that are covering a very big space and don't have even sufficient funding. We have a problem in addressing the animal reservoir sample collection. Whenever we approach, I remember when I was the regional advisor in Emro, and we requested some collaboration with some animal reservoir with forest, and we requested funding, but it was difficult to secure funding. Many donors are not interested in funding animal reservoir surveillance. So how can we address, for instance, a disease like Lassa fever, disease like Marburg viral disease? How can we address Ebola? I think these are things that the participants will have to take away and think about it. And if there are donors in this audience, I think they would take this seriously and think about this. We can't stop disease like Ebola, like SARS corona, like Marburg, if we don't have sufficient funding and to increase the staff and to have the commodities for the supplies, necessary supplies to collect animal samples, and in order to correlate with to detect disease before even the spillover to the human habitat. So I believe we have to strengthen community participation. Our communities are not informed. Many are not even informed on water safety and foodborne safety. Food is used as just crudely and artisanal way on the markets, and we don't know not many infection prevention and control security interventions are done in order to protect our population. So they have to be informed on the risk and start to prevent themselves from the disease. Thank you, and I hope there will be questions. So again, I am not requested. I think honestly and humbly that we need One Health ministries and not just a coordination desk at the Prime Minister house, like in our case in Tanzania, or the deputy the first deputy president in Tanzania, in Zanzibar, or we don't need whatever the structure is in any other country. We need a fully integrative One Health ministry addressing all the disease and all the conditions that put population at risk. Thank you very much for listening.
Thank you so much, Professor Amar. That was a very insightful presentation and very important key takeaways from your presentation. And now we will move on to the second speaker, Dr. Charles Akataubi Michael, who is the Senior Technical Officer at Africa CDC. I have a question. Charles, do you want me to share your presentation?
I can share from here if you permit me to. Can you hear me?
Yes. Do you want me to share your presentation?
I think I can share from here if you allow.
Yes.
Okay.
You can share. Perfect.
Okay. Trying to put it on presentation. I'm trying to put it on presentation mode. Just a minute. Sorry.
It's in the bottom line where you can maximize or minimize the screen. The image right next to it.
Okay. Okay. Can you see it now?
Yes, we can see it, but we can also see your notes next to it. I can share your slides if you want to.
Okay, maybe you show.
Okay.
Okay, thank you. So again, good afternoon, colleagues. I'll be presenting on exploring the climate change nexus with food and waterborne diseases in a changing world. And I want to thank Prof for setting the premise for this presentation. So beyond all the other drivers of food and waterborne diseases, climate change is a significant contributor. Next slide, please. We do know currently that one of the most existential realities of our time is the impact of climate change. So if we talk about a changing world, one of the things we need to deal with is a changing climate, which directly impacts on diseases. Now, one of the things we need to know is that the fact that climate change is actually redefining what we have previously known as factors or social determinants and environmental determinants of health. And it's important that this is taken into cognizance in health programming. And there is no better way to address this than looking at it from the prism of a One Health approach. Suffice to say that Africa as a continent suffers the greatest impact of climate change, despite the fact that they contribute the minimum to climate change causes. Next slide. Yeah, I tried to illustrate because the topic is looking at the nexus between climate change and food and waterborne disease. I first tried to set a premise between the nexus between climate change and infectious diseases generally. And like many of us can align with, if you look at the disease causation pyramid, For disease to occur, whether foodborne or waterborne, there are three elements that are essential. These elements are the agent that causes disease, the host that gets diseased, and an environment that allows these two to interact. And it's good to note that climate change, anything that affects any of these apices of the triangle, will definitely alter the dynamics of disease causation in any setting. And it's good to note that climate change can affect all of the three apices. Climate change has the tendency to alter the susceptibility of the host. Sometimes increased heat stress can actually predispose somebody whose immune system was initially intact to come down with diseases. Climate change, of course, alters the environment, increasing ambient temperature, causing droughts, or also causing increased precipitation. All of this which can contribute to an environment that allows for disease to thrive. Also, the agent, climate change can alter, of course, we know that increased ambient temperature sometimes can increase multiple folds of the ability of disease-causing agents to be able to become more virulent or more pathogenic. And this has been proven by research. Next slide. So with this knowledge in mind, next slide, please. With this knowledge in mind, it's good to narrow down within the context of our discussion. And we're looking at two media, which is food and water, and how these provide an opportunity for disease causation. I have highlighted here the interactions of the various segments of human existence with health, but I've narrowed down on agriculture and food security and water sanitation and hygiene, because this speaks directly to the context of our discussion this evening. And I need to highlight here that food and water are great medium for climate change impact on health. And you know why? We must eat and we must drink water. And imagine that you're drinking the milky water that Prof alluded to initially. There are, of course, those challenges, but it's good to note that climate change is increasing the vulnerability around food and water availability, and also all the diseases that are associated with these two media. Next slide. So with this understanding, it's good to highlight the current burden of our realities. The WHO has said that 23% of all global deaths are linked to the environment. And this translates to greater than 12 million deaths per annum. Of these numbers, 2.2 are actually happening in Africa. And if you check the contribution of Africa population to the overall global population, you will know that this is a great deal of deaths occurring. But one thing I needed to point out is that whereas there are several causes that are contributing to this death magnitude, infectious disease, though they rank 6th, 7th, 8th, 9th, and 10th, it is good to highlight that the greater part of these infectious contributions are actually in Africa. Whereas maybe in other developed climes, you can look at stroke, you can look at ischemic heart diseases and all of that. So, and within this infectious disease transmission, water and food play a very significant role. Next slide. So, despite these nexus that I've tried to illustrate, it is good to note that most discussions on climate change usually often exclude health. And that you can verify by looking at previous COP discussions and negotiations that have happened, even the most recent one. Although from the COP 28 and 29, the one that happened in Dubai and the recent one that happened recently, we've started trying to bring the health nexus. But from my own perspective, I believe that climate change is the face of health is the face of climate change, because whether you look at climate change from the point of agriculture or from the point of the environment, the major recipient of climate change impact is the human person, which is usually translated into mental and physical well-being. Next slide, please. But so, although health is left out, it is critical that all discussions going forward, especially around the nexus of One Health, include climate change as a critical determinant of health. This is primarily because looking back over the last 2 decades in Africa, we've had more than 2,000 public health events. Of this number, 56% are said to be driven by climate change causes. Okay, that is since 2001 to 2021. And beyond that, futuristically looking at also the health situation, it is estimated that climate change has a tendency to cause over 250,000 deaths annually if adaptive and resilient measures are not taken into cognizance. So suffice to say that of all the key contributors of climate-sensitive disease, water and foodborne disease are critically important. And that is why even in Africa, majority of our countries are currently having cholera outbreak, despite the fact that cholera has been earmarked for elimination by 2030. And you can see the retinue of listed diseases that are resulting from water and foodborne, all of which are climate sensitive. Next slide. So what's the pathway? How does climate change mediate this impact that we've just illustrated? Now, one of the 2 critical determinants of climate variabilities is temperature and precipitation. And we do know that in recent time, there has been increments over 1.5 degree in some quarters of incremental temperature changes, okay, from what we've usually known. And we know the implication for this. It is already, there is evidence that with every 1 degree addition in ambient temperature, the propensity for Vibrio cholerae as a causative organism for cholera, a waterborne disease, increases more than double-fold. And so you can imagine what happens in an environment where there's incremental temperature changes. And this is also in addition to the heat stress that this imparts on those who are living within those climates. So with those heat stress, coupled with the increased population of the causative organism, you already know what to expect. So temperature and precipitation drive primary effects, sometimes that are direct, but sometimes also causing things like changes in water bodies, leading to flood, leading to drought, and all of that. And of course, this either increases the exposure of human population and animal population to pathogens that they wouldn't have ordinarily come in contact with. We've seen many times flooding, washing off diarrhea disease causing agents to hitherto free areas. That we've seen very well with a lot of diarrhea diseases. And we've also seen foods that are not usually cooked, like vegetables, also being contaminated with fecal constituents of disease-causing organisms, and usually in driving food and waterborne diseases. Next slide. So it's also worthy to note that trying to look at the interaction between climate change variables and also disease prevalence, we found out that of the 10 climatic hazards, which are all sensitive to greenhouse emissions are some of the key drivers of climate change, because greenhouse emission is one of the contributors to incremental temperature changes that we're seeing in our world. And of course, we've seen that these climatic factors like global warming, temperature-related variability in precipitation, whether drought or flood, cyclones, and all of that, all of these actually are causing about 60% increment in contagious illnesses that are faced by human beings. And we've listed some of these. Of these, food and water play a significant role as media to be able to enhance the distribution of this. Next slide. So I've tried to show this illustration using the Eastern African context. There are about 14 member states in Eastern Africa where I currently oversee. And you'll find out that both cholera and typhoid fever, both of which can be mediated through water or food. You see the distribution. Almost most of the countries in the region are actually impacted. And beyond the Eastern African region, you see this as also having significant impact on human health across the continent, and even in many countries in Asia. Next slide.
Charles, you have 5 more minutes.
Okay, I'll try to round up. So I just try to point out beyond the beyond the impact on human lives and mortality, there's also the financial implication. Direct damage caused in health due to climate change is estimated at over 2 billion by 2030. And this actually, for a determinant that has this level of impact, it becomes a rallying point for all those who are interested in public health security at both global, continental, and regional level. Next slide, please. So one of the things that we've come to notice is that this impact has a gender dimension, with women and children being most impacted. Can you click and let the whole thing come on? So when we look at this impact, you see that children, women, especially in the African context, are usually most impacted, and the elderly, because some of the indirect exposures that are associated with climate change have women and children usually at the greatest receiving end. Next slide. Yeah, so you see whether you're talking of air pollution, you're talking of contaminated water, water scarcity, children and women are usually the ones who are most impacted, and directly they are affected more by the burden of this disease. Next slide, please. So how do we address these linkages? We've tried to talk about the nexus, and I think that has been clearly highlighted. But here we need to understand that One Health is the most appropriate context to be able to address this. And what is One Health? We've defined it from the Africa CDC perspective as a collaborative, multi-sectorial, and transdisciplinary approach used to attain optimal health outcomes for people, animals, plants, and their shared environment. And because climate change plays a critical role around this setting, it is also important that adaptation and resilience to climate change becomes a critical consideration in One Health programming. Next slide, please. So I'm just going to highlight a few things we're doing at Africa CDC. We've suggested some of the, I've tried to highlight some of the things we need to do to address climate sensitive diseases, especially those mediated by food and waterborne disease. And I need to say that we know that resources are scarce, and that is why it is good for us to prioritize and map diseases to know where to concentrate efforts. We need to strengthen epidemic and pandemic preparedness because climate change is going to definitely offset the balance in this scenario. We need to intensify surveillance and surveillance systems, making sure that they are strengthened, whether we're looking at indicator mortality or event-based surveillance. We need to be able to become more predictive in our approach. Okay, next slide. So in Africa CDC, to show you the importance of food and waterborne diseases, these are one of the key priorities in our 5-year strategic framework, and we're looking at how to mitigate foodborne and waterborne diseases. Next slide. And to do that, we've identified key areas of intervention spanning across governance and leadership, capacity building, risk communication and community engagement, research, innovation, and data share, use of data for informed decision making. Please, next slide. We're also looking at public health emergency and disaster response, while also looking at innovative financing and strengthening national public health institutions across the continent. Next slide. Yeah, these are just some of the things we've intervened in. Our climate change and health program started back into is new, starting in 2023, but I think a lot of efforts are being put in place. The continent requires a lot of support in this area, but much more importantly, I want to leave us with this. It is important that in the One Health context, climate change is considered in all health programming because it's a critical factor. It can affect disease causation. It can also limit ability to respond to diseases, as evidence have shown. I want to thank us for listening, and thank you, Efremia, for this. Thank you very much. Yeah.
Thank you so much, Dr. Charles. Very interesting presentation. And we will now move on to our next speaker. So Dr. Carmen Varela Santos, Principal Expert for One Health in the Disease Program Unit of ECDC. And Carmen, I can share your presentation.
Yes, please. Thank you very much. Thank you for this opportunity to join the webinar because it's very inspiring to hear about the situation of One Health in different parts of the world. As you probably know, the ECDC, the European Centre for Disease Prevention and Control, is a European agency of the European Union based in Stockholm. And our core mandate is actually to identify, assess, and communicate the risk posed by communicable diseases and related special health issues, like, for example, antimicrobial resistance. We were established already 20 years ago, triggered by the SARS epidemic, but our work was probably better known and tested during the COVID pandemic. So because of this, in November 2022, we were given strengthened mandate, and there was also, as part of a so-called EU Health Union package, a new regulation to address serious cross-border threats to health. This was also complemented by other legislative measures, but I will not go now into that detail. If I give you a general idea of what does it mean for ECDC, we are now investing more on the area of epidemiological surveillance, in particular in digitalization and integration of surveillance systems. There is also work ongoing on supporting the member states together with the European Commission, or on the use of modern technologies like artificial intelligence for epidemic intelligence purposes. So we are also having a strong investment in the area of foresight to be more using an anticipatory approach and, let's say, more strategic, and to support the European Union in setting a research agenda in our field. It was already mentioned by Dr. Charles. It's really important, the area of preparedness and response. And in this sense, thanks to the new regulation, ECDC is conducting country visits in all the EU, EEA countries for the assessment of their national preparedness plans for public health emergencies. And we have also established a so-called EU Health Task Force for deployments of staff in Europe and abroad, both for preparedness and for response. We have also to invest further in the area of supporting the capacities for the health systems. And here there is the establishment of EU reference labs for public health and the expansion of the work on prevention. And finally, but very important, we are expanding our role in global health security, and of course, intensifying the collaboration with our partners like the World Health Organization, or with countries under the European Neighbourhood Policy, or other CDCs, like, for example, Africa CDC. Maybe next slide. Yes. So here I only bring an example of an area where it's clear the fact that we need to do more using or applying the One Health approach, and is in the operation of the disease networks for epidemiological surveillance. So here we have to conduct not only the analysis of the burden of disease and the trends, which we have been doing for many years, but to do more in the area of identifying what are the risk factors from different perspectives, well, social, economic, climate, or environmental aspects. We should also look more into the identification of groups at risk and vulnerable populations, and to contribute to the research priorities and needs. We can go to the next. So here we are implementing, or we assume, the One Health definition that was established by the European Commission in the regulation of the serious cross-border threats to health issued around the time of our strengthened mandate. And of course, it's about the intersectoral work, having in mind that to tackle threats in an interdisciplinary and intersectoral way, you really need to involve all the different players. Is of course necessary for different aspects, and they have been already mentioned very nicely by colleagues, so I will not go into these specific issues. Because of this implementation of the One Health approach and the fact that it really needs a good harmonization of efforts within the agency and with other agencies, I'm going to present briefly what we did in-house in terms of One Health framework and what we did with the other institutions. So for our ECDC framework, we established an internal task force of experts, and we also consulted our ECDC advisory forum, and we defined some components or so-called enabling pathways that would make possible the achievement of certain strategic objectives. So these enabling pathways, I can list some, are, for example, the definition of One Health procedures and work processes, clarifying roles and responsibilities. The other is a good monitoring and evaluation mechanism, the respect to the principle of scientific independence, or the need to secure resources for implementation. Maybe we can pass to the next. So in terms of strategic objectives, we have the first one, which is the establishment of an interagency task force or cross-agency task force, which is already now in place, and is not, of course, only our success, but the joint success of the different institutions. Then we have two additional objectives that are at the EU level and that have to do with the establishment of a joint research agenda and with the mechanisms to conduct a rapid risk assessment and scientific advice. This would be at the EU level. But for the member states, we aim also to establish or supporting them to establish good intersectoral coordination mechanisms and intersectoral surveillance and early warning systems to make sure that there is good interoperability between the platforms. Finally, and of course is very important and is both at the member state and at the EU level, we are also having an important strategic objective in the area of workforce capacity and training. So we can move to the next. So I should also highlight that this is a long-standing work and cooperation that we have already in place between the different agencies in the area of One Health. And here, this is the case for the European Food Safety Authority, for EFSA, with whom we produce on an annual basis the joint One Health zoonosis report with data from humans, animals, food, and feed. But we also publish, for example, so-called rapid outbreak assessments on foodborne diseases, or quarterly updates and assessments in the area of avian influenza. You can see on the slide the front page of the JACRA report, which is in the area of antimicrobial resistance. And in this case, is both EFSA and ECDC, but together with the European Medicines Agency, who are analyzing data on consumption and resistance from humans and animals. And we have already had 4 editions of that report, and we keep now with the 5th. We can maybe move to the next. This is another very recent example, which is of collaboration with 5 agencies. So it's the 5 I mentioned, and then we have also the Environmental Agency and the Chemicals Agency. And here, the assessment was about how the use of acyl fungicides outside the human medicine is affecting the resistance to Aspergillus. So it's a very important output and a good example of collaboration, where there were data collected through surveys and from different databases after very intensive literature reviews among the different experts from all the sectors involved. We can move to the next. So I will show now a bit the history of the formalization of our collaboration between the 5 agencies. So what happened was that because of the COVID-19 pandemic, the European Parliament was stating very clearly in their recommendations and based on the lessons learned that it was important to have an implementation of the One Health approach sustained through the establishment of this cross-agency task force. So the commitment was made actually among the agencies during the One Health European Conference of June 2022 in Brussels, together with the European Commission, a very big hybrid event. And then there were contact points identified by each agency, and the work started. So 1 year after, the 5 agencies met again in another conference, and there was also an important statement published all together called the Cross-Agency Knowledge for One Health Action, which again tries to advocate for joint surveillance and scientific advice and capacity building. So the work continued, and then in May last year, we had the publication of the Joint Framework for Action, which is a plan to be implemented in 2024-2026. So we can move to the next. And yeah.
And also, Carmen, you have 5 more minutes.
5 more minutes, yes, I will be fast. So the Cross-Agency One Health Task Force has an advisory role to the executive directors, and of course, it's these 5 agencies with an observer from DG Sante. And at this point, is being chaired by ECDC. We have a rotation system. We can move to the next. So the vision is to have an effective coordination and cooperation, and of course is having in mind the response to public health emergencies and following the 4 principles like stated in the quadripartite recommendation of the 4 Cs, as we call it: coordination, collaboration, communication, and capacity building. We can move to the next. So this framework for action is organized in 6 different strategic objectives. So the first one is on strategic coordination, and here is because we really acknowledge that there is a need to provide strong and aligned scientific advice to the policymakers and to avoid duplications and avoid the divergence. The second strategic objective is, we can say, I will go around briefly. The second is on research coordination. So here is a bit similar to what I already mentioned on the One Health research agenda. The third is really on training. So it's capacity building, and it means that in a way, I mean, the agencies are already knowledge brokers, and not all of them have a strong mandate in the area of training, but there is, of course, a focus on knowledge exchange, on even training for the staff, and interdisciplinary learning and use of lessons learned from simulation exercises for continuous improvement, of course. Then we have the strategic objective 4 on communication and stakeholder engagement, which is really about involving not only the entities with whom we work more closely, which is probably the European Commission and the countries, but also a broader range of stakeholders, including, of course, academia, NGOs, industry, or policymakers, and improving the collaboration and the knowledge exchange. And then, of course, we have another objective, which is about joint activities and mandates. So now I will give you a brief summary, if we move to the next, on what is the timeline. So as you can see, there is still work to do, and we have to implement those actions related to the objectives. But very interestingly, we can move to the next slide. The Health Commissioner 2 years ago requested advice on the area of One Health governance in the European Union to the group of chief scientific advisors, which are normally producing recommendations for policy to the European Commission. And so as a basis for this scientific opinion, there was an evidence review report produced. And I will simply give you now in the next general idea of what are those recommendations. And there is actually more information available in the website of the scientific advice mechanism that I encourage you to look at. And they even organize their own webinar tomorrow. So if someone is interested, I really invite you to join. So this scientific opinion, which was published last November, includes 6 main recommendations. And they consider the policy landscape and the current structures and initiatives at the national and European level. In brief, there is an idea of aligning with international definitions of One Health, with the OLEP, the quadripartite, to develop a collective EU vision and strategy, adapting also the quadripartite theory of change, and to work in a coordinated way with multi-stakeholders, networks, and platforms. We can move to the next so that I don't repeat too much. In summary, there is collaboration at the EU level in place already for several years. It has been formalized through legislation, task forces, and joint frameworks. We have defined some strategic objectives for intersectoral collaboration between the agencies. We are supposed to support the Member States and the European Commission to strengthen this One Health coordination. And in the area of One Health governance, I really advise you to look more in depth into this recent scientific opinion, but the key message is also the importance of developing One Health strategies both at the EU and at the Member State level. Thank you very much.
Thank you very much, Carmen, for this interesting presentation. And now we will move on to our next speaker, Dr. Victor Daniel, Global Health Advisory Board member of CABI. We will talk about the foodborne and waterborne diseases in a changing world from a low and middle income country perspective.
Hi, can I share my screen?
Yes, yes.
Okay, thank you. Okay, please confirm you can see my screen.
We can, yes.
Okay, thank you very much. My name is Victor Daniel, and today I'll be speaking about reaching One Health Horizons from a low and middle income perspective, and I'll be speaking from the Nigerian perspective. And I'm sure why Nigeria, and green, white, green is the flag of Nigeria. That explains why my slide is green. So Nigeria has over 230 million people with a highly diverse geopolitical and climatic conditions. In terms of disease burden, Nigeria suffers from one of the highest disease burdens for most diseases across the world. We've had emerging zoonotic diseases, food and waterborne diseases like Lassa fever, rabies, cholera, monkeypox, dysentery, etc. And this means that we bear the brunt of a lot of the conversations that we'll be having today. And thanks to Professor Omar and Dr. Charles, who has spoken extensively, which provides a background for what I would be speaking on today. What I hope to achieve from this presentation is to show the interconnectedness of food and waterborne diseases, and also to speak from this with the progress Nigeria has had with the One Health approach. Additionally, I want you to know more about Nigeria and to get feedback from other countries and other clients who have succeeded with some of the things we're looking to achieve, and see if there are any learnings that can be adapted in Nigeria. So I'll just be going straight into it. Just give me a second. So in Nigeria, waterborne and foodborne diseases are major public health threats, and this is linked to over 200,000 deaths annually. leading to losses financially of over 3 billion. Now, considering that Nigeria is a country where 70 to 75% of the medical expenses are paid out of pocket, food and waterborne diseases do not just affect the health and well-being of people, but also affect their finances, thereby plunging many families into poverty. Waterborne diseases like cholera and typhoid are still endemic, and this is further worsened with poor water access, as only 19% of Nigeria's population have access to safe drinking water. A lot of other systemic factors still affect Nigeria in terms of our attainment of the One Health approach, and I'm going to be speaking to that in the further slides. But a few things to note here is that we have a high attrition of healthcare workers. Health implementation or health services at the primary health level, healthcare levels are still very weak. Thereby, people in rural areas, urban slums, or certain disadvantaged regions still have very poor access to healthcare. So what exactly are the disease pathogens that affect Nigeria? I'll just be highlighting a few. I know there are a lot of experts here when it comes to epidemiology and these diseases, so I would not be hammering on that. But in Nigeria, we've had multiple outbreaks on cholera, we've had diphtheria outbreaks, and this is from a number of factors. First is lack of access to clean drinking water. So many Nigerians have to make do with any water source they find. And this can range from the kind of water that was shown to us by Professor Omar, and then other, sometimes even worse sources than that. Additional things that also affect is poor sanitation and also inadequate waste management, especially in urban slums where you have indiscriminate defecation and indiscriminate disposal of waste goods into waterways, further exacerbating access to clean drinking water. Well, I'll be highlighting some of the enablers of water and foodborne disease in Nigeria. The first is surveillance and detection. And this is a common decimal across a lot of African countries, but considering Nigeria's large population, this is seen more in Nigeria. We lack a national surveillance system for tracking foodborne diseases. While a lot of work has been achieved in immunization and in tracking of vaccine preventable diseases and surveillance, foodborne diseases and waterborne diseases are still, there's still much to do in this regard. Additionally, there is a dead need for additional funding. The current fiscal space for health in general is quite lower than averages across many European countries, and it's just about 4% of the GDP of the country that is allocated to health. We also have gaps in availability of healthcare workers. This ranges from community health extension workers to medical doctors. Across many facilities, we do not have the right amount of healthcare workers to provide services. Policy and implementation gaps. For many of the programs, we have good policies, but there is some limitation in terms of how we implement these policies. And while we have strong institutions who have been saddled with this responsibility, we see that just the sheer size of the country and the sheer spread and the fact that we share borders with a lot of countries has also limited their ability to implement some of the control measures that have been set out for these agencies. So moving on to climate change, Dr. Charles already did a very extensive conversation on this, so I'll try to just move on from here really fast. I think Dr. Charles is an expert here, so I won't say much on this, but just to highlight the case for Nigeria. Climate change in Nigeria manifests through a number of ways: flooding, droughts, erratic rainfall, and in the past 10, 15 years, we have experienced two major flooding in 2012, in 2022, and just last year, we also had flooding in 2024. What we've seen is that with this flooding, we've seen that there is the humanitarian issues and all the challenges that is experienced during flooding, but we also see that there's a lot of medical emergency as floods lead to the drinking water sources, both for animals and for humans, are then filled with pathogens that then cause diseases like cholera and dysentery. We've also seen that in the northern part of Nigeria, that is closer to the Sahara Desert, we've seen that there is an increase in droughts. This further forces communities to source for drinking water sources and water for their animals, thereby leading them to use very unhealthy water. Also, rising temperatures. I think Dr. Charles touched on this, but one of the things we've also seen is an increase in bacterial growth, especially as some of the bacteria that cause typhoid, like Salmonella, thrive in warmer conditions. So with the increase in the environmental temperature, we've seen also an increase in pathogen spread, and we're now seeing more drug-resistant strains. An additional thing I would like to touch on here is for antimicrobial resistance, which is something we see now, and it's a cause and effect. So with increasing cases of cholera, with increasing cases of dysentery, etc., we've seen a high abuse of antibiotics now, and that has also had a significant impact upon how the country is able to drug usage across the country. I'll just touch on an example. Last year, we had a flood that affected 31 states. Like I said, I hope to help you know better about Nigeria. So Nigeria has 36 states, and 31 of these states were affected by the floods. And this flood impacted over 1 million people. And this left over 600,000 people displaced, 285 people dead, and 2,504 people injured. And the picture you have here isn't of Nigeria, but it's just a picture to also depict the extent of the kind of damage we have seen in Nigeria. And this have also exacerbated humanitarian issues, poor hygiene practices, further increasing the causes of these food and waterborne diseases. Moving on from here, I would be speaking on the One Health approach in Nigeria. Nigeria has made some progress with implementing the One Health approach. We've set up coordinating platforms, we've developed policies to guide the One Health approach, and this has yielded some results, but there is still more to be done. One of those coordination approach, the National One Health Ministerial Steering Committee, brings together the Ministry of Agriculture and the Ministry of Health, and these together try to align on health for human beings, health for animals, and the environment. While this has been established at state level, at federal level now, we implement a federalized system in Nigeria. We also have states where this has not been cascaded to, and also at the local government level, there is not a lot of these coordination platforms. One of the challenges of this, of course, is that the fact that this doesn't exist at lower levels means that many of the resolutions, policies that need to be implemented on the ground are not done because there's a disconnect between what is happening at the higher levels, which is the federal level, and what happens at the local government levels. We also have policies that guide One Health in Nigeria, the National One Health Strategic Plan, and the National Action Plan for Health Security. These are also plans that have been developed in Nigeria and policies that guide how One Health will be implemented. And these are adapted from global policies and global best practices. But one thing we do see is that there is a dearth in terms of the implementation of these policies. What are some of the major challenges with implementing One Health in Nigeria? First is inadequate public awareness. A lot of people in Nigeria are not very conversant with the concept of One Health. And that means that across at the health facilities, the points of service delivery, there has been no established relationship between our implementation of climate change interventions as well as our work with zoonotic infections. So there seems to be some dichotomy, especially among healthcare workers, veterinary workers, as these two implement parallel activities. Also, high-level stakeholder engagement for health managers and political leaders at the lower level is still very low, and there's no clear understanding of the One Health approach. I've highlighted the second bullet point that most of the interventions are at the federal level and haven't been cascaded to the lower levels. Additionally, there's inadequate funding for many of the One Health activities, which has also limited our ability to scale most of these activities. Surveillance and information sharing across the One Health sectors, so from the zoonotic and food zoonotic side of things to the human health side of things, there's no the interoperability and sharing of information is still very weak. While a lot of focus and effort is being placed on the human health side of things with vaccine preventable diseases, sexually transmitted diseases, etc., we've seen that there is very little information sharing for zoonotic diseases and then environmental impact of this environmental impact of climate change on health. But the story is not all bad. There are still bright spots. There are still some very interesting progress that has been made. And I'll just touch on that very quickly. One of those is the implementation of the IDSR, Integrated Disease Surveillance and Response System. This was integrated in Nigeria in 1998 and has significantly improved our ability to identify and respond to outbreaks. And with cholera, we've seen a reduction in incidence of cholera. We've had one outbreak last year, and that was effectively contained as the turnaround time between identification of an outbreak to alerting disease surveillance team has reduced significantly. We've also been able to introduce an integrated risk assessment and management. Nigeria is a very large country, large urban population, large working population, and that in turn ensures that we have a lot of street vendors, food vendors, especially in our capital cities. With the National Food Safety Committee, we've seen that more of these, we have now food and food safety supervisors who check a lot of restaurants and street food vendors to ensure that they are compliant with the hygiene practices, and this has reduced incidence of foodborne diseases and food poisoning, especially in urban areas where this is a major practice. For community engagement and public education, we've also seen a lot of NGOs and CSOs come into the country to support government with advocacy, social mobilization, and communication for One Health, especially for hygiene practices. One of the things that COVID left behind for us in Nigeria is a hand washing practice, where we see more people now practice hand washing and other hygiene practices, which has further reduced disease burden for food and water-borne diseases. Also, with local radio programs and through funding from partners like WHO, UNICEF, etc., have also improved awareness on the impact on better water treatment practices. And we've seen some of all that yield good results.
I'm Victor, sorry to interrupt you. You have 3 to 5 minutes more.
Okay, so I'll try to wrap up here. We have some innovation and advances that have also been introduced in more recent time that have helped to reduce the burden of food and waterborne diseases, and also integrate better One Health approach across disease areas. I will just gloss over that and then just move forward to my recommendation and call to action. Like I said, I hoped to be able to also learn on things that have worked in other climes. But one of the things that I think, and it's critical for Nigeria, is the ability to implement many of the strategies and plans and policies that have been identified to strengthen One Health implementation, strengthen surveillance across zoonotic diseases, food and waterborne diseases, and also strengthen climate change improvement practices. Also, there is a gap in capacity of healthcare workers to be able to implement many of the One Health practices considering that Nigeria hosts over 1 billion livestock, it's very important that we also focus on strengthening the integration at lower levels of veterinarians and healthcare workers, and to ensure that we're able to implement One Health at this point. So thank you very much. I hope you know a little bit about Nigeria now, and you've also benefited from the presentation. Thank you.
Thank you so much, Victor. Yes, we learned something new about Nigeria. All right, so now we will move on to our Q&A session. And yeah, if there is any question. Is there? Yeah, I think everything was very clear, apparently.
I have some questions.
The second.
Actually, I have a question from Dr. Carmen about the ECDC and the EU policy. How can interdisciplinary collaboration between public health, veterinary, and environmental sciences enhance early detection and response to emerging foodborne and waterborne diseases in a changing climate?
Thank you very much for your question. This is something where I have not really discussed much, but besides our cross-agency task force, there is also, I hear an echo, there is also a climate and health observatory, a European Climate and Health Observatory, where several different EU agencies, but also other institutions, including the World Health Organization, or for example, in the European Commission, the Joint Research Center, have an active role. So I think that this is going to be an area of work that will only grow, as it was already discussed today. And I think that it's really important that we keep establishing those connections between climate health and One Health, which are not always that obvious. And in this type of partnerships is probably the only way that that we can in which we can succeed. It cannot be done by individual organizations, but by the coordination of efforts from different teams. And of course, in the area of climate at ECDC, with the new mandate, we will also need to have a good reflection in the future about how we can invest more in this intersection of climate and health. Yes. I don't know if this was sufficient reply.
Yeah, thank you so much.
Okay, thank you so much. And so I think there is no more question, right? Okay. So as we conclude this insightful discussion, I would like to show you our call to action to mitigate the impact of food and waterborne diseases. You can find it in the chat, the link, and you can sign it. IDA urges governments, industries, healthcare professionals, researchers, and civil society to adopt concrete evidence-based measures that align with the One Health framework. Our recommendations include improved hygiene and infection prevention, sustainable farming practices, public and private partnerships and global collaborations, equitable access to treatments, and stronger MIM stewardship in healthcare and veterinary sectors. As the Infectious Disease Alliance, we want to advocate for increased funding and policy action to eliminate the impact of foodborne and waterborne diseases. Stay informed and collaborate, so you can share today's insights with your network and explore ways to contribute to safer food and water systems. The Infectious Disease Alliance will continue its work in supporting research, innovation, and advocacy to combat the foodborne and waterborne infections and promote safer food and water systems. We encourage you to stay connected, participate in future events, and take action to your communities. Thank you all for joining the webinar. Thank you for your time, dedication, and commitment to global health. We look forward to continued collaboration and progress.